The following is an orientation video of one of the mannequins that will be being used during a simulation session, either within the simulation suite or in clinical practice. The simulation mannequin provides an opportunity for clinical staff to practice their healthcare skills in a safe learning environment. The mannequin itself is fundamentally a computer in a rubber body that can do a range of realistic actions. The mannequin is controlled to allow changes to its presentations and observations in line with the scenario learning objectives that have been written to support your clinical area and your level of learning. Faculty members who are observing the scenario but are not taking an active role in the treatment of the patient will be wearing an orange vest which says Simulation Faculty. During the scenario, the expectation is that you are working within your normal clinical remit. So if you need to escalate or call for help, please do so. At the start of the scenario, you will be given a brief but realistic handover which will contain all the relevant information in order for you to start your assessment and management of the patient. This mannequin will be used to represent an adult patient during the simulation session. The expectation is that you treat the mannequin as a real patient throughout the scenario, so please interact with the mannequin when making your assessment. There may be faculty members who are actively involved in the scenario, such as a nurse or family member. Again, we expect you to interact with them in the same manner. In order to get a baseline of the patient, you can attach all the usual forms of monitoring, such as SpO2 monitoring, 3-lead ECG, non-invasive blood pressure cuff, respiration rate, temperature. There will be a patient monitor that will record these observations. The mannequin cannot move unaided. Therefore, if the patient needs to be rolled or transferred, please bear in mind that it weighs approximately 70 kilos. Therefore, use usual moving and handling provisions as if this was a real patient. The mannequin can blink and the eyes can be open, partially open, or closed, dependent on the scenario. The pupils will not change size or react to light. Therefore, the faculty member will give you the information, but please perform the task. The mannequin's airway patency may vary during the scenario. Therefore, manoeuvres and adjuncts can be incorporated during the management of the patient. Head tilt chin lift, jaw thrust, oropharyngeal airway, nasopharyngeal airway, laryngeal mask airway or I-gel, intubation, bag valve mask ventilation, front of neck access. When considering airway management, the mannequin has the ability to have variable lung compliance, tongue edema, and can't intubate, can't ventilate. If the mannequin is conscious, you can actively communicate with each other. The voice of the patient will be a member of the simulation faculty acting in character. The mannequin's chest will rise and fall both bilaterally and unilaterally. The lungs and heart can be fully auscultated with normal and abnormal sounds. Auscultation can also be carried out on the abdomen, as bowel sounds may be present. You can physically perform a needle decompression on the mannequin to treat conditions such as a tension pneumothorax. This mannequin has full pulses both centrally and peripherally. To activate the pulses, initially press down firmly and release. During the scenario, the pulses will start to cascade like a real patient. Therefore, in any emergency situation, feel for a central pulse. There may be a patent cannula in situ, which can be used to deliver both IV fluids and medication. If additional access is required, place a cannula on the surface of the skin in the relevant site. We expect you to draw up the medication following normal safety precautions and administer the IV medication in real time. For oral, subcut, topical, IO, PR, PV, and IM routes, please prepare the medication in the usual format, but at the point of delivery, verbally indicate what you would do, but please do not administer the medication to the mannequin. You can perform CPR on this mannequin if required. Cardiac compressions and bag valve mask ventilations can be monitored for depth, speed, and correct use. If the defib machine is required, attach the simulation defib leads to the mannequin. These are positioned where you would usually position your pads. If you struggle to put these on, a faculty member will help you. This mannequin may potentially bleed. Therefore, please fully examine the patient. It is important to remember that the mannequin has significant limitations. These include: the mannequin can't change the colour of its skin, or sweat, or swallow. Therefore, a faculty member will give you this information when requested, such as the patient is looking quite pale. You cannot physically take bloods from the mannequin. However, get all your equipment prepared, take it over to the patient, and verbally indicate what procedure you are doing. Due to the complexity of the mannequin, occasionally there may be technical difficulties. This will be indicated by the faculty member, who will give you additional information and instructions.